Yeah, so we've been having a lot of questions from our patients about microneedling. So we have with us today, this is the micro pen. It's one of 4 different pens that are available on the market. There's the DermaPen, RejuvaPen, Skin Pen, MicroPen. These are all microneedling devices. So many of the questions that patients have been asking is, how often can I repeat a treatment? Well, depends on the depth of the treatment, but most patients don't want to repeat a treatment more than every 4 to 6 weeks. Certainly you don't have to do it nearly that often. I typically say that somewhere around 2 to 3 treatments is going to offer you what you can notice as significant change with significant increases in collagen and elastin that have been laid down in the skin. Again, this is a skin treatment, so you're creating a strategic injury, very controlled, to basically let your own body lay down new collagen and new elastin. So a couple of the other questions that patients have had about the microneedling devices: what do you put on the skin afterwards? Well, it's up to the patient. So one of the most common things we do is hyaluronic acid. So HA is a sugary protein that's found in your skin naturally. It's in many of the filler materials that we're doing, like Juvederm and Restylane, Belotero, Voluma. So these are all HA, sugary proteins that we put underneath the skin as a filler treatment. So often we'll put an HA on the skin, and then when you create these tiny micro channels, the HA can actually get into the skin, as well as your body, again, is laying down new collagen and new elastin in those micro channels to heal them. A couple other things that we do quite often is PRP. This is platelet-rich plasma. So this is a procedure, if you've been watching some of our other videos, where basically we'll take a tiny amount of blood from the patient. We separate it into its components. So there's the red blood cells that we don't need, white blood cells we don't need. What we do is we take the platelets and the serum. And so the serum is very rich in cytokines, which are cell-to-cell signaling molecules that tell the body to accelerate the wound healing process. So we'll take the PRP, which is your own liquid gold, so to speak. It's your own serum and cytokines, and we can place that both topically on the skin, or if the patient has a particular problem area, you can inject that just like a filler type material to a specific area that you have used with the microneedling device to basically increase wound healing. So HAs and PRP are what we think are our 2 favorite things that we put on the skin. There are many other techniques across the board, and I'd be happy to speak to you about those, but those are 2 of our favorites. So if you have any other questions, please let us know, and look forward to seeing you on your microneedling treatment. Thanks.